All right, so we want to talk about rheumatoid arthritis. It's such an interesting thing to find out that rheumatoid arthritis was one of the early manifestations of Lyme, right? Wasn't it?
Well, that's what I thought it was. I thought it was an epidemic of juvenile rheumatoid arthritis in these kids in Connecticut, and they went to investigate it and found out that it was Lyme disease.
Wow. And it's also interesting to think that arthritis, rheumatoid arthritis specifically, is triggered by infections, and that so many doctors don't know. That's so mind-blowing. When we just looked up the numbers, there are almost 1.3 million people in the U.S. right now living with rheumatoid arthritis, or something that they call rheumatoid arthritis, which I think you would call a constellation of symptoms.
Right. I mean, I think that I have a basic problem with the whole field of rheumatology. I'm like, look, I know some very nice rheumatologists, but there are a lot of rheumatologists who don't like me because I keep saying that it's a field that doesn't know what causes any diseases that they use as a diagnosis. And all of their diagnoses are descriptive diagnoses. There's not any etiologic diagnosis. Say, look, this is the cause of RA, this is the cause of, psoriatic arthritis. This is just another description of signs and symptoms, and some immunosuppressive drugs that are very expensive and very toxic and never cure anything and have people on medicines for the duration of their lives. I mean, I think we have to realize that pharmaceutical companies are not looking for cures. I hate to get preachy, but it's a business, and it's far more lucrative to have an immunosuppressive kind of a long-term 40-year treatment in patients than to give them a 6-week cure. I do think that there's quite a lot of data that's published that demonstrates that there seems to be a microbial basis to these rheumatic presentations. For example, with rheumatoid arthritis, there are 11 randomized controlled studies showing that antibiotics work for RA and placebo doesn't.
That is mind-blowing.
Yeah, and they've compared it not just against placebo, but also against steroids and methotrexate. So steroids suppress the immune system, and methotrexate is a chemotherapy drug which wipes out the immune system and suppresses it very strongly. And if the antibiotics are working when these powerful immune suppressants are not working, it speaks to it not being an anti-inflammatory effect of the antibiotics. It speaks to it being an antimicrobial effect. It's not publicized, and these are very tightly controlled studies, and it's the highest quality research we have, but it doesn't make front page news.
So you're saying that rheumatologists diagnose people with these conditions, and they are never looking for the root, and that if you find the root and it's an infection like Bartonella or like Lyme, you could actually get at the root cause of the symptom and resolve the RA.
I think it's always better to get to the cause than to treat an effect. For example, I had a patient who had a tick by New England, and very shortly, I always said it's the most severe acute presentation of rheumatoid arthritis I've ever seen. She had grossly swollen joints, like her ankle was like this big, and her rheumatoid factor shot up into the many hundreds. And she went to a few rheumatologists, and they, her Lyme ELISA was negative, and they, one of the doctors treated her with doxycycline because they have them right after the tick bite, but they really didn't pay it much mind. And I said to her, I said, look, any rheumatologist is going to treat you with immunosuppressive drugs, but I'm not a rheumatologist, and I don't look at effect, I look at cause. I try to find the cause of things. And I offered her treatment with rounds of antibiotics, and she did actually not go very well, and she never required immunosuppressive drugs. So she came in, with a mindset that she didn't want immunosuppressive drugs, and she was very much convinced it was an infection because it all happened after a tick bite. And I kind of agreed with her. I mean, I think that she was really smart. But what about the people that don't get a tick bite, or they get a different type of bug bite that spreads Bartonella?
That's the question. So what are the infections specifically that trigger arthritis, rheumatoid arthritis, psoriatic arthritis?
I think there's more of a link with Bartonella than there is with Lyme even. There's a lot of data linking Bartonella to rheumatic syndromes, both rheumatoid arthritis and spondyloarthropathies like psoriatic arthritis.
Wow.
So I guess the focus of today's talk is RA, so we'll just stick to that. But yeah, Bartonella is kind of nasty when it comes to rheumatologic conditions.
How do people get a proper diagnosis for Bartonella? What are there specific labs? What should they be asking their doctors? What specific tests should they be asking for?
Well, there are clinical features also that in my practice that I've come to think are fairly specific. Things you see with Bartonella. I think that there's two kind of syndromes that in my mind speak towards specificity, and one is the inflammatory arthritis kind of syndromes, and the other is this neurologic presentation that I see with Bartonella.
Can you just explain that too?
The neurologic features of Bartonella that I find are specific, that are not published anywhere, so these are just my Phillips signs.
Your 21,000 patients that you've seen?
Yeah. So,
I'll take it. Go ahead.
Yeah.
Shoot.
Well, so things like breakaway weakness, where the leg buckles out and or the people drop a glass and their hand is strong again, and there's like intermittent grip weakness, and so it breaks away this way, and then the kind of mirror image of that is myoclonus, so it goes that way. So breakaway this way, and then myoclonus that way. Myoclonus is like a shaking motion, and so you shake this way versus breakaway that way. Just interesting how they're just two mirror images.
Okay.
And then there are certain features lab-wise with Bartonella that don't really happen with Lyme so much, like a low white count, elevated inflammatory markers, like C-reactive proteins, vascular endothelial growth factors can be elevated.
Okay, wow.
Things like that show breakdown of red blood cells, like a haptoglobin is a chemical that goes down when the red blood cells get broken apart, and Bartonella can do that more. The spleens tend to get enlarged, more of the Bartonella, lymph nodes tend to get more swollen. Yeah. And Lyme doesn't tend to do that stuff as much, So.
What's the best lab for Bartonella testing?
Well, I have a fondness for Galaxy. I don't have any financial relationship with them at all, just so everybody knows. But I think Ed Breitschwert is super smart and nice. And
who's Ed? Sorry, don't know.
Ed Breitschwert is a world famous veterinarian who's done a tremendous amount of research in Bartonella. He's published close to 200 medical journal articles, and he has this lab, and they have some testing that's a bit advanced in terms of Bartonella. He's kind of on a mission to change how we view Bartonella, as am I. And so that's who I prefer. Yeah.
Okay, great. So in terms of treating Bartonella and getting to the right kind of care, what kind of a physician should patients seek out if they think that they have this presentation?
I think a doctor that's kind of affiliated with ILADS would be a reasonable start.
Okay.
I mean, I think that unfortunately we have this situation where Bartonella is largely ignored, and folks are told that it'll go away eventually. I remember I had this pregnant lady who had Bartonella, and we found Bartonella antibody in her blood at one lab, and little bits of DNA of Bartonella in her blood from a second lab, and they were both kind of these non-controversial, well-accepted laboratories. And it was one of the few times I sent her to an infectious disease doctor, and the infectious disease doctor was like, well, I agree she's got active Bartonella. And I was like, I'm glad that I sent her, to you because she's so sick. And he's like, yeah, so thank you for that. I was like, yeah, thank you. What do you want to do?
Yeah.
And he's like, nothing. That stuff goes away. We don't treat that. And
where'd they get that impression?
Well, cat scratch fever, frequently is self-limited, and sometimes it's not, even cat scratch fever, But
is Bartonella the same thing? So I always think of toxoplasmosis as cat scratch fever, and I'm a little bit confused as
Bartonella is cat scratch fever.
But aren't they both referred to as cat scratch fever, or is that...
No, I don't think so.
Okay,
I think Bartonella is referred to as cat scratch fever.
Okay.
But a lot of microbes have different presentations. Not always does a microbe present in the same way in the same people. And you can get a cat scratch fever presentation that could be self-limited. You can have a cat scratch fever presentation that's not self-limited. You can have nothing at all that looks like cat scratch fever, which is the majority of what I see, that is more insidious and, it's kind of like the frog that's slowly boiled and doesn't jump out of the pot. That's the thing that I use a lot of times. So I do think that Bartonella and inflammatory illness is intimately kind of linked. And, if you treat one, you can frequently make the other better.
Okay, and my last question is, how many patients get better when they're treated with antibiotics? If they know that, if they find out it's an infection?
The large majority do. But, Bartonella is harder to treat than Lyme is, and it takes usually, in my experience, rounds of antibiotics, and sometimes one round of antibiotic could just kind of flare it up and make it worse, and you just stop at that point. It's like kind of the worst decision, because there is such a phenomena. It's kind of like stirring up the pot, and that's misery. But that takes a lot of patient education, because if they don't know, if the doctor doesn't communicate that, and if there's no kind of a trust, like a doctor-patient trust relationship developed at that point, you can lose contact with the patient, and they can decide not to get treated.
Is it a Herxheimer reaction that you get when you start a Bartonella drug, or protocol?
Yeah, I think that it is, but it's more complicated than just kind of simple kind of a die-off. Did we do a video about Herxheimers? Maybe we should.
We did. We did a little bit, but we can talk more about it.
And stuff.
Yeah, we can talk more about it.
I just think there's a lot of blebbing that happens with Bartonella, and it just seems like it's a little more complicated than Lyme is.
I see.
It's more stubborn, more complicated, harder to respond.
Okay. All right. Good. Well, we'll send patients to the right care, which is ILADS trained doctors, ILADS.org. I don't really know a better place to send people because ILADS trained doctors are trained to look for infections that cause all these illnesses. So
Zoonotic infections.
Zoonotic infections, and it's really hard. Even I have Bartonella, and I went to a bunch of infectious disease doctors, and they all missed it. It resulted in heart failure and lots of other problems. So that's also my personal recommendation as a patient. So thanks.
Thank you.